bride doesn't want to look good by shedding a few pounds for her wedding day, but how far is too far? A new extreme diet, it's called the KE diet, promises that you can drop anywhere from 10 to 20 pounds in 10 days. Here's the catch here. You have to wear a feeding tube. Goes right up your nose. Sounds lovely, doesn't it? Here to give us more on this rapid weight loss fad and its possible dangers is registered dietitian from Boston, Kate Scarlata. Thanks for being with us here.
Thanks for having me.
So I can understand brides want to look their best. Who doesn't understand that? But we're talking about a tube up your nose. This isn't exactly glamorous. What is it? What exactly does this entail?
It's outrageous, actually.
Right?
So you put a tube down your nose into your esophagus and have a mixture of fat and protein blended and just dripping slowly 24/7 into your stomach for 7 days. Yeah, very bride-like.
Right? Yeah. Oh, yeah. It's glamorous. Does your fiance get to watch as this all goes on?
Exactly.
So you eat nothing else. This is literally all the sustenance that you're getting.
Absolutely. You can take an hour and have a little tea, perhaps no carbohydrate, water, beverage, that sort of thing, but nothing by mouth, food-oriented or that would have carbohydrate in it.
And you do this for 10 days.
Correct.
And is this something new, by the way, or is this, where did this come from?
This originated from Italy and then kind of hit the UK and now is taking the US by storm.
All right, and obviously some dangers, I would imagine, associated with this. What's the problem here?
Well, you know, there's a lot of dangers, but the biggest one would be aspiration pneumonia, and that's because when you put a tube down your throat, the door to your stomach and your esophagus remains open, so stomach contents can actually come up and get into your lungs and cause pneumonia. And that's a big risk, and a lot of these women are doing this. It doesn't seem like there's a lot of monitoring going on with this procedure.
Right.
Yeah.
Well, I was going to ask you about that. So, I mean, if this is something, not that I want you to tell people how to go get this, but, I mean, do you go to the doctor and they insert it and then you go home? I mean, are you doing this on your own for 10 days?
It sounds like certain doctors would actually put the tube in and hopefully have skills to do so. You can damage your septum, this throat irritation, and then the aspiration risk. So there's risks with even a doctor placing a tube.
And we were talking just a little bit before. I don't know what the makeup is of whatever it is that's going in you, but I assume we were saying it's no carbs, no... What is it exactly that's going in there?
It's just a protein and fat emulsion. They use medium-chain triglycerides, and it lacks carbohydrates, which is very concerning to me because women by nature have less serotonin than men, and so we tend to depend on a little bit of carbohydrate to keep our serotonin levels elevated. Serotonin is a brain chemical, and it makes us feel calm. And who doesn't want to feel calm, especially a nervous bride-to-be? So it's really important that these brides understand that without the carbohydrate, they really could turn into exactly, an emotional basket case.
Wow.
And so not a good strategy.
So I mean, I would hope that most people could imagine this would be a bad idea. What ideas would you give people or brides that do want to drop a few pounds? I know there's no quick weight loss, fix, but what would you tell them? I would tell them, of course, seek the guidance of a registered dietitian who's trained in helping people lose weight. And also, for $1,500, you certainly could hire a personal trainer and get some guidance with exercise. 20 pounds, really, you can do that easily in 3 months, and most brides have at least a year of planning. Right. So it seems very drastic and not really very respectful to their bodies. All right, brides, you heard it here first. Kate Scarlata, we appreciate your opinion on this.
Yeah.
Thanks so much for joining us this morning.
Sure.
All right, Jean, to you.